I'm 30 years old and 4.5 weeks post-op from my total knee replacement. And today I want to talk about a somewhat controversial topic, and that's pain after surgery and during recovery. The reason I say it's controversial is because I'm already expecting comments to say, I was in so much pain, or I experienced feeling this way, I experienced feeling it this way. Everybody has a different experience post-op, and I'm the first person to say that everybody's experience is different. However, the notion of pain is a widely discussed topic in your recovery. About 25% of patients experience a lot of pain post-op. About 25% of patients experience no pain post-op. And then there's that 50% of patients who believe they're feeling pain but actually aren't, and they're kind of recategorizing what pain is. Pain is pain, but there is also discomfort and stiffness and swelling that a lot of people mistake for pain. But it's extremely important to differentiate between the two and take the time to think about the two. This is surgery number 8 for me. I've gone through a variety of recoveries. My most intense recovery was after my MACI and cadaver cartilage transplant procedures, where I could put no weight on my knee for 8 weeks. I couldn't bend my knee past a certain point. That recovery was extremely painful, so I know what pain feels like. I've also been suffering in pain for 5 years leading up to this total knee replacement, so I know what that pain feels like. But coming out of my surgery, I genuinely cannot say that I experienced the same type of pain. Again, I was in excruciating pain before surgery. Coming out of surgery, I felt a lot of stiffness, a lot of discomfort, and a lot of swelling. In those first few days post-op, I definitely had some pain as my nerve block was wearing off. You know, they do a lot to your knee during your surgery, so you do feel some pain. But after those first 4 or 5 days, that was completely taken over by stiffness and discomfort. If I sat for too long, my knee stiffened up, and those first few steps I took hurt, but it wasn't a pain hurt. It was a discomfort and stiffness hurt. And it really is important to distinguish the two, and you may say, why? It's all painful in my eyes. Pain could lead to bad outcomes. Discomfort and stiffness is part of the process. And discomfort and stiffness you will feel for months post-op. If you're sitting for too long, if you move your knee the wrong way, if you sleep on it, you're going to stiffen up and you're going to have to work through that. Pain, on the other hand, is not always something you should be working through. That's what you should be talking to your physical therapist about. That's what you should be talking to your surgeon about. The only pain I had truly was in my calf and in my quad. That was painful. We worked through those things with my physical therapist. I talked to my surgeon about that, but my joint itself didn't have that same feeling of pain. That's also why I can confidently say that after the first week post-op, I felt so much better than I did before surgery because I wasn't experiencing the same pain. Again, everybody's experience is different. I'm hearing some people say that they are in so much pain that they can't even walk. I do want you to think, though, when are you experiencing that pain? Is it those first few steps after you've been sitting for too long? Is it constantly? Is it when you're sitting and not moving? These are all important things to consider throughout your recovery, because the key to success for a lot of these surgeries is moving more than you think. Pain will stop that. Pain will stop you from progressing in PT. Stiffness and discomfort can be pushed through. And so if you're able to push through that discomfort, you will feel better earlier on. So it is important to think about pain and discomfort. I highly, highly recommend you speak to your physical therapist about this and try to understand the difference between the two. And I urge you to really think about it for yourselves throughout this recovery. Force yourself to say, am I in the pain that I was in before surgery? Is this just stiffness that I can work through? It will help you substantially. It's so important to know when you can push past a certain feeling and when you have to tone things down to not push past pain, because it could be causing you damage. So again, what is pain? What is discomfort? What is stiffness? Do your research, talk to your providers. Leave it in the comments here if you've experienced some of the same things. Let me know if you truly have been in excruciating pain post-op. Let me know if you agree that a lot of your pain is actually stiffness and discomfort. I'm so interested to hear about other individuals' journeys. And again, not every journey is the same. This is my experience. This is what I've researched. This is what I've seen. But every patient is different. So if you are in pain, I hope that you are recovering well, that you will get better soon. If you're doing well post-op, I'm so happy for you. Let me know in the comments where you are in your journey and if you have any questions or thoughts along the way.